was a victim when I was 14 years old. Once I was recovered by law enforcement, I was taken to an emergency department. So as a survivor myself, I think hospitals have a big role in addressing human trafficking.
Human trafficking is a public health concern that is growing day by day. Hospitals and caregivers can identify these victims and actually put actions into place to make sure that they're taken care of.
Victims of sex trafficking are very likely to come into contact with healthcare providers. In fact, in one study, 88% of female adult and adolescent sex trafficking survivors reported seeking medical care while they were being exploited.
I truly believe that it begins with the acknowledgement that human trafficking didn't just arrive, that it's been here all along, hiding behind the surfaces, and that we truly have not been educated on how to identify it.
Human trafficking is hiding in plain sight. It's one of those things that, just like child abuse years ago, that if it's not on clinicians' radars, they're not going to see it. They're not going to know something that they don't have on their, differential diagnosis. I think hospitals can take a real leadership role in this, just simply by working on a plan for identification and referral for trafficking.
So we know that they're going to come into contact for health care, be that for pregnancy testing or pregnancy care, sexually transmitted infection testing and treatment, HIV testing, things like that. We know they're coming, so it is really imperative that we as healthcare professionals are able to identify high-risk children and adults so that we can offer services, because we may be the gateway to help for some of them.
So human trafficking started to have a larger uptick in the last 3 to 5 years, and Allegheny Health Network has recognized this as a problem. One of our chief nursing officers did her doctoral work about human trafficking, how to identify the symptoms of human trafficking such that we can identify these victims and actually help them at the point of care.
These are hidden populations of patients that we know are seeking care at hospitals and other health facilities across the country, but they're not often detected. And so it's a population that we should all be paying attention to.
One thing that I encourage all hospitals to do is actually train the security staff in their emergency rooms to be their partners in providing clinical care and be an eye into what is happening in the emergency room, and to feel comfortable approaching the clinical team and saying, I saw something that I think you should be aware of. I also really encourage people to create protocols and have those posted all throughout the emergency room and throughout their community clinics or urgent care centers about how to create that first referral. So you don't have to know every social services group and every substance abuse program and every bed that's available, but you do need to know who to call and make that be your one call. And then lastly, I think if you don't have a 24-hour social worker in your hospital yet, that should be a huge priority, because too often medical students, residents, nurses are in that role and don't feel equipped to be. And so if you want to make a dent in this issue, you have to have somebody who knows how to access those resources.
We have no excuse to not look at this. Just as we look at child abuse or domestic violence or anything, this is an issue that's coming into our emergency rooms and our health facilities on a daily basis. So hospitals have to be a part of the solution. I also think that, hospitals, we can be a really trusted provider. And that's not necessarily always a given, certainly with someone who is experiencing human trafficking, because there are lots of barriers and challenges as to why someone would or would not self-identify. But, a hospital should be a much safer place, more of a trusted presence, I think, for that person than a lot of places. So if we have any opportunity, really, whatever our opportunity is, whatever our in is, we need to be addressing this, and especially knowing that we're seeing that many people.
What I've been really impressed with is that there are several organizations that have been really committed to this issue, and the work that's been done is truly remarkable. But what hasn't happened is that this issue has gained a widespread acceptance and knowledge among hospitals across the country. The people who work at hospitals are very well-meaning and want to help their communities. And if this issue can not just be by individual experts in different pockets around the country, but can become something that is widespread across the country and part and parcel of what every hospital does in their communities, that would be a terrific result.
Where we are now is much better and much further along than we were even just 5-6 years ago. And when I started this work, there were just a few number of healthcare professionals that were recognizing this as a public health issue and that were trying to ring the alarm on this issue. Over the years, we've seen an uptick in the acceptance of trafficking as a serious public health problem, but we still have a long way to go. And I think I still hear providers that say, well, this is not relevant to me. It's not something that I see. It's not something that is happening here in the United States. So making sure that we are communicating just how important this is and how it is an issue that touches upon all specialties, because just as much as I see patients in an emergency department who might be trafficked, so does the reproductive health clinic, so does the dental care clinic, so does the surgeon who might be performing surgery on a broken bone. We're all responsible and we're all seeing patients, and I think reaching the point where we accept the fact that just like child maltreatment and just like intimate partner violence and just like elder abuse, we are all likely to come upon patients that are experiencing trafficking. We have to know how to respond to this.